Health officials have said Texas is one state they are monitoring. Joining me now is Governor Gregg Abbott. And first of all, Governor, thank you for joining us today. My first question for you, as federal officials have said Texas is a state on their radar, what precautions are you taking at this time to further limit the spread of COVID-19 here in the Lone Star State?
We're doing several things to make sure that we contain the expansion of COVID-19 in the state of Texas. The primary thing that all Texans can do is to make sure that they are following both state and local orders to stay inside, stay at home. I know this is so frustrating for so many people, but there really is right now only one thing that we can do to make sure we prevent the spread of the coronavirus, and that is for everybody to stay home unless you're involved in essential services. This won't last that much longer, but we have to make sure we start bending the curve of the expansion of COVID-19 in Texas.
With Texas seen as sort of a hot spot for the virus, why has there been a hesitation in implementing a shelter-in-place order statewide?
Well, we do have a statewide order, stay-at-home order, to make sure that everybody in every corner of the state is staying at home. And this is in conjunction with advice not just from the Texas doctor, Dr. Hellerstedt, but also I talk weekly with Dr. Fauci and Dr. Birx, the two doctors you see with the president every day. And Dr. Fauci told me this past weekend in a one-on-one conversation, he said the statewide standard that we have in the state of Texas is the appropriate standard. The only thing we need to make sure we achieve is compliance with that standard.
And here in Harlingen, there's been an outbreak of the virus at a nursing home. It killed 2 people. Are you planning on putting any guidelines in place for nursing homes across the state?
So in my executive order, those guidelines are already there. The nursing homes are the most let's say, susceptible place for the expansion of COVID-19 with vulnerable people who are in those nursing homes. As a result, going back to my original executive order almost a month ago now, I made very clear there were strict standards at nursing homes. No one is allowed in or out of nursing homes except for personnel. And if there's anybody violating that, they are violating the law in the state of Texas, because we are making sure that the people in our nursing homes will not be exposed to COVID-19.
And how is your administration implementing that across the state?
So when I issued an executive order, it has the force of law. There are penalties. It's a crime. You can be arrested and put in jail for 180 days. Every law enforcement officer in the state of Texas is authorized to enforce that law. It could be your local police department. It could be your local sheriff. It could be the Texas Department of Public Safety. Any law enforcement officer can arrest anybody who violates these orders.
And you've approved for medical professionals in the Houston area to treat patients with an anti-malaria drug, despite it not being approved by the FDA. Do you have any concerns about that? Do you think this drug will soon be available for use in other parts of the state?
Yeah, to be clear, I did not approve that. What is happening is this is a decision that must be made by doctors. This is a medical decision. Well, all I did was to announce the fact that doctors are using this medication at a nursing home center in the Galveston area. And we will be learning pretty soon, later on this week, about the effectiveness of this particular drug. We have seen public reports about this drug being effective elsewhere. If it works here in Galveston, we will be able to expand this in the state of Texas. Importantly, though, this is a decision to be made by doctors.
Thank you, Governor. And with that, do you have anything else you'd like to add as you're with us today?
I do. I want everybody in the Rio Grande Valley to know a couple things. One, we have a massive increase in the amount of personal protection equipment, the PPE, that's so desperately needed. Over the past few days, we've been able to distribute more than 2.5 million masks that are so desperately needed. The other thing that we did is we took an inventory of all healthcare facilities to make sure that we would have adequate number of hospital beds, adequate number of ICU units, adequate number of ventilators, so that in Texas we would not be facing a situation like what we've seen in New York. We are in great shape right now.
Thank you so much again for your time today. We appreciate your leadership as we battle this pandemic.
My pleasure. Thank you all.